Hi there, it's Ian Wright. I just want to talk to you about asthma because it's World Asthma Day coming up this week, and I just wanted to talk about what we do when we work with asthma. This will coincide with one of our long-term patients is going to give a little testimonial, really, I suppose, about the treatment of her children that we've been doing or the management, let's say, of her children that we've been doing for a long period of time. That will be on the Facebook and on the website, I think. So, I've been lecturing about asthma for 20 years, actually, to osteopaths, to postgraduate osteopaths, especially with regards to pediatrics, but also in the management of asthma in adults as well, all around the world. And it's a difficult thing for us as osteopaths who are hands-on therapists to treat. And the first thing we want to say is that we have to be part of a team that works with this situation, especially in chronic, difficult situations. Asthma is a long-term inflammatory disease that affects the lungs, especially the lower airways, the bronchi, characterized by wheeze, breathlessness, cough. The point about asthma, as opposed to other lung conditions, is this spasm called bronchospasm that happens in the airways is reversible. So these changes can come and go. This gives us an opportunity, but also it's difficult. It's an alarming thing to not be able to breathe. So when people who are in a process of an asthma attack or with mild asthmatic symptoms, they're finding it difficult to breathe, and breathing is our most natural thing. So it sends us into distress. It's very common that children who have asthma, it makes them distressed, and it's completely understandable. Asthma in my clinic is locally, by the doctors around us, being diagnosed younger and younger and younger. You wouldn't normally have diagnosed asthma until sort of 2-3 years old. And I'm seeing children younger and younger being diagnosed asthma. There was a time locally where 50% of 5-year-olds in schools were being diagnosed and being treated for asthma, which is huge. Now, I think that was accentuated because of the situation of the local town that were close to the practice, which is in a dip, very damp, etc., etc. But that's higher than normal. But you have a 5-year-old diagnosis in Northern Europe of maybe 30-35%, which is very, very high, really. It's a complex picture as to why someone gets asthma. And I just want to talk about a few of the factors that we work with and I've found. The first thing to talk about is this whole idea of the atopic symptom. Atopic is reactive allergic, and it has this triad of symptoms. One is chronic rhinitis, which means sinus issues, production of mucus, sneezing, reactive. The other is eczema, which is an inflammatory skin condition, very common. And the third is asthma. So this is a primary immune reaction. The immune system is overreacting to the environment, and it's incredibly common. We see it a lot. And so a lot of asthmatic children will have lung and sinus issues as well, and sometimes tummy issues, which I'll talk about more later. There's very much a genetic component in it, family's history, that you can see 3 or 4 children in the family with asthma. Mum had it, dad had it, grandma had it, etc., etc. So there's very much a genetic thread that comes through it. There are certain specific issues that can predispose to asthma. One being, in my personal opinion, bronchiolitis, which leaves a localized kind of tissue constriction reactivity, which can kind of make the tissues react. Other issues that can predispose to it, apart from family history, are other immune system problems. Premature babies, because of their treatment, because of the lung surfactant issues, and possibly they've been ventilated with CPAPs, etc., can make them more prone to airways reactivity because the lungs have been put under strain. But I'll talk about prematurity much more in another talk. What we personally find is a lot of reactive airways can be linked with a postnasal drip, so a sinus issue, where the sinuses aren't draining correctly. They're dropping down the back of the nose and irritating the upper lungs, and they cause this reactivity. So often sorting out the sinuses or helping with the sinuses can be helpful. And actually, a lot of doctors prescribe medication for the sinuses as well now because of that. There's this, coming back to the immune system. The immune system is really key. There's two elements I want to talk about in that. One is what I would call immunosensitivity, meaning our immune systems have become increasingly reactive over the last few years, because almost we live in this chemical soup of irritants, potential irritants, in terms of the clothing we wear, the environmental elements, pollution being increased, passive smoking, etc., etc. So we're surrounded by these potential irritants, also in our foods, additives. There's a lot of things that are in our environments and what we ingest through the water, etc., etc., can cause this low-grade irritation of the immune system. And this means the immune system could get reactive and sensitive. It just gets full almost. It's like the glass is full and the body starts reacting to whatever. Within this is this idea of this hygiene hypothesis, meaning, which is actually the other side of it, the other side of the coin, which they both work together, is this: because we live in these super clean environments now where kids aren't necessarily out eating dirt, playing outside in the woods, everything is clean with antibacterials. Kids are more prone to having cesarean sections, so they're less prone to having contact with the bacteria in the vagina, which actually is very important and has been shown to be very important in the development of the gut biome, which we've talked about in previous times. So reduced exposure to bacterial endotoxins, which are the parts of the bacteria that are reactive in the body, so the body doesn't get used to it, means when actually we come into contact with these bacteria later, we react more. So our reactions get greater. So this kind of super clean environment plus chemical environment. So you've got these two sides which are both working to sensitize and dysfunction our immune systems. Okay, so coming back a little bit to the idea of the gastrointestinal system and the gut biome, there's something called gastric-associated lymphoid tissue and bronchial-associated lymphoid tissue, which is underneath the banner of mucosal-associated lymphoid tissue. Now, what this is if someone ingests, say, something that the body doesn't like, for example, dairy produce, and there is a localized reaction in the gastric-associated lymphoid tissue, there will be an identical reaction immediately in the bronchial-associated lymphoid tissue. So these tissues react in synergy, which is very interesting. So if you eat something that your body doesn't like or is slightly reactive to, it can cause a lung reaction, which is very important in asthma, and vice versa. Something that you breathe in can actually make you more reactive through your gut. Just talking about sinuses and nose breathing and mouth breathing, the sinuses and the development of the sinuses are very, very important in the development of asthma. If you've got a child who's got a blocked nose and is mouth breathing, that can impact, and they stick their tongue out, etc., etc., that can impact the development of the sinuses, because the sinuses aren't fully developed when we're babies. They develop as we grow, partly due to the breathing through the nose. So the movement of the air helps create these airway sinuses. So if these If we're mouth breathing from very early on, it stops the sinuses develop. Now the sinuses are very important with regards to airways reactivity for two reasons. Sinuses have two purposes which help our lungs, because our lungs are a direct reaction from the outside world to the inside world. That's where they meet, one of the most clear points of where they meet. So the lungs are prone to being affected by anything that's in the environment, for example, pollen, etc., etc. So we can react very strongly. Now, if we've got a good and functioning sinus, it does two things. The first thing is the mucosa in the sinuses collect these potential irritants, and they deal with them before they get to the very sensitive lung tissue. The other side of it is the sinuses warm up the air. The air is cool. We warm it up through the sinuses so it decreases our airways reaction. So we need good functional sinuses. That's very important. That's something that we tend to work with. So, okay, how do we actually look at this and how do we work with this? The first thing to say is very important. Asthma is a difficult and dangerous condition, and we work secondarily to the medical doctors, the pediatricians, or the doctor's input. So we can be supportive, we can help, but we have to do it in secondary to them, because what we're gonna do is look at strengthening the function in the best ways we can. So the first thing we need to do is to manage triggers, work out what trigger is dairy produce, in the way that I talked about before, having an increased reactivity in the lung fields, or is there an incredible amount of dust or mold spores in the house? What are potential triggers? And if we can learn to manage triggers, it can be very helpful in the management of asthma. The medical way is the normal routes of the bronchodilators, which work locally on the bronchi to actually stop their constriction, and corticosteroid inhalers, which are more of the long-term preventative, which dampen down this increased immune response. But, of course, long-term use of them can have effects on the kidneys. But from osteopathically, how we look at the children it's a long-term thing. It depends, actually, if it's an acute diagnosis of asthma. So, for example, some child's had chest infection, it's got all a bit stuck, and then they've developed a wheeze and their airways have become reactive. By working with those kinds of children, we can hopefully get a quicker result. But if we're looking at chronic, difficult, it's more of a case of management. So we're looking at working the mechanics of the function of the ribs, because the ribs get tight, the intercostal muscles get tight, the diaphragm gets tight, there's poor drainage. We're looking at the function of the sinuses and the throat drainage. We're also looking at treating the fluid dynamic in the body, which is how we support immune function. We look at the throat and the drainage of the ear, nose, throat is very important. We're also looking at specifically at the sympathetic nervous system, which tends to be locally reactive, and that causes bronchoconstriction, bronchospasm even. And the interesting thing about the sympathetic nervous system, which is our kind of adrenaline, it is how we react to stress by producing stress hormones, including kind of adrenaline. And that tightens up the lung fields. That's a direct effect of an increase in in the sympathetic nervous system, and there are various ways we can work with that. So when we're working each child, there isn't a prescription of how to treat that child. We have to look at the factors within each child's case that are involved and support in whatever way we can. But they're under the doctor's auspice. We support them. We get everything going. If we can get their symptoms decreased and get them stronger, then they can go back to the doctor and talk about medication changes, but only then. Just one word about differential diagnosis of asthma. There are various things that you'll see in the clinic. Croup, which has this horrible barking. It's a viral infection which can affect the lower trachea and the upper bronchi. Nasty, but it's viral. Bronchiolitis actually tends to affect younger children. very high temperature, but it can, as I said before, have an effect in triggering a later asthma attack, in my view. Pertussis, whooping cough, bacterial, but they have this gasping stridor, increased temperature. Very nasty thing, very tightening up of the throat. Pneumonia, bacterial or viral, very high fever. Now, you can also have just normal bronchial infections, chest infections, which can be either viral or bacterial. All these things affect the lungs and can be triggered by these viral or bacterial environments, which can actually, if not treated correctly, can trigger asthmatic responses later. So the lungs are a big area to work with, but they're very interesting to do so, and there's a lot of techniques that we can do to be supportive as much as we can in those situations. Thank you.